Integration or the correlation of theory into practice. What is integration? Integration is the key element for the correlation. It refers to the continuous, intelligent, and interactive adjustment. Theory is like a thinking, practice is doing. Theory helps us to explain the knowledge and practice. Why? If you see the definition of theory, theory is a set of concepts, ideas, propositions, and interrelating of the concepts in order to view the particular phenomenon is called the theory. So it is helping to guiding into the action. So theory and practice should be correlated with each other in order to bring the best practice in nursing. So what is the purpose? We can see that is a universal standardization and uniform practice and develop the professional skill, help the students to be more independent, to take a decision making, to improve the general skills, to identify the learning needs, help to link the abstract into concrete, research application, evidence-based practice, to promote the clinical reasoning, to improve the analytical evaluation ability, to apply the new knowledge in a complex situation. Because situation always dynamic in the healthcare industry, to improve the clinical decision making skill. In this chapter we are going to see what is this learning is taking place by the KAS or knowledge domain, cognition, that's affective psychomotor domain. All these things will be applicable by the competencies will be developed by performing those skills, not only learning the theoretical. Cognition will be the scientific knowledge, learning like a comprehension, understanding, learning will be taken place. Everything will be like listening, learning, behavioral science you will do, pharmacology, scientific principle, what, why, everything you will be learning it. What is called psychomotor? Psychomotor, something which is in the nursing, we do need a skill to do the procedures. Body mechanism is important to care for the patients and to anticipatory need of the patient should be satisfied. Then will be the for that how you will do it. Affection means affective domain. It's a behavior, attributes, when, where, why you have to do, what is the norms, and what is the IP or communication skill, analytical skills, and motivation. All this needed. To perform this, you need a competencies. How these competencies can be developed in a professionals. These competencies will be developed by various aspects like the critical thinking skill, clinical judgmental, reflective learning. This one, it is by the platform where you are learning the skills and who is the teacher going to do it. So it is the responsibility of the organizational approach. How are they going to build this correlation of theory into practice? What are all the approaches? First, the organization and the INC, everything should be guiding into the organization to support them to correlation this one. First approach we can see is the organizational structure. The hospital and the educational institution should be nearby. It will be very easy for the planning. They can work cooperatively, make a weekly plan which students are going. So how they are, is there any institution applying? Yes, of course, if you see NIMHANS or if you are seeing the institution which is nearer to CMC Vellore or Delhi, some of the private government hospital are doing it. So morning these students will be going to the clinical area and afternoon they will come to the class. In the clinical, teachers who are working there will be coming and taking the classes for the students. The cooperative MRP, cooperative CRP making with the knowledge of the both the teachers planning properly. This is the one approach. Reflective practice in teaching. Why reflective is important? Reflective teachers are so flexible. Reflective teachers can understand the feeling of the students. Reflective students can understand the empathy towards the patients and they understand, they will be very actively participation. So this reflective learning will be very much useful. What they learn, they can come and reflect into the practice. How you are going to do? You can make a teacher can make in a flexible approach. Those students, for example, cadaver nursing. So everybody will not get a cadaver opportunity. If you one student got an opportunity to assist the cadaver nursing, you cannot provide this opportunity to this one. So the reflective teacher will organize in a class 10-minute time will be given to this student nurse who assisted the cadaver nurse. So this student nurse will be narrate the experience to all the students, so the other students will understand, if I become a cadaver nurse, I will be doing this. And continuity. Continuity is an important aspect. Continuously organization and clinical, they have to continuously plan. If there is a integration and continuation and sequence is not there, there will be a big gap between the theory into practice. Sequence, it should be in-depth knowledge and skills. The previous knowledge should be, previous experience should be related with the current experience. You have to emphasize what you learn. And this one, integration, as I told in the beginning, integration is the key element for the correlation. What is this? You look at this one. This is how you can plan. We tell that both the organization and other people has to plan it coordinately. How you can plan? What is curriculum? Curriculum is a set of curriculum. The curriculum is a group of people studying in a particular this one. This one curriculum will be planned for the particular program, particular students to achieve the educational objectives for the particular group of students. By the teacher it is made by. So this curriculum consists of, you should have, what is the curriculum? The curriculum organization, any model of curriculum, what they are telling. Any model, it's, you take Rolf Taylor model, any model telling that first is the formulation of a philosophy. Then develop the objectives from the philosophy, and then selection and organization of learning experience and evaluation of learning experience. This is called the curriculum. So this curriculum planning should be by the joint planning. Who is the joint planning? Joint planning by the hospital and the curriculum expert in the college. They work together. So what is the work they together? They have to divide their work. You get, they are the in charge how they are working. Their evaluation, clinical evaluation can done by the teachers who are there working. They can give it to the class teacher of here. So it is a cooperative approach. So their assessment also you are involving. Lecture also you are going to involve them. Call them, give some guest lecture. For example, neurological assessment. They are very good. MSc nurse who is working in a CMC Vellore. These teachers are coming and really teaching to the students here. Role of a local mentorship or staff nurses has been involved, and then hidden curriculum is also taught to them indirectly. So the curriculum implementation, you are involving the clinical people. So the theory is automatically integrated to the clinical practice. So already when they are student, they feel that they are already empowered. So when during the internship period itself, they can take up a charge, and their the hospital burden also will be reduced. The head nurse burden will reduce, and they will learn the things, and the confidence will be increased in the students. Conclusion, if you say integration of the nursing education with the nursing service is important to give a quality of nursing care. So without that, there is no quality. Quality has to start from the nursing students when they join in the first year of nursing. Unless until you have integrated the theory into practice, we empower the people, hospital people to come and take the class, and you go and achieve them. This integrative model will be helpful to improve the quality of nursing. Thank you.